Thank you so much, Mr. Mayor, Mayor and Council. Thank you for this opportunity to present on our collective response to COVID-19. This evening, what I'd like to do is share with you some of the extraordinary work of our dedicated employees in responding to COVID-19 over the past year. This has been an unprecedented emergency, and the response of our leaders, community, and employees has been incredible. And I'd like to thank all of you, Mayor and Council, for your vision, your leadership, from creating the Berkeley Relief Fund to providing gap funding to our local businesses and arts organizations to providing crucial protections to renters, to seeking to employ special strategies to help our most vulnerable in our community. Additionally, I would like to acknowledge the sacrifice and just the flexibility and hard work of our city staff. My department heads have been stellar. In particular, I like to recognize our first responders and essential service workers who from the very start of the pandemic were on the ground making a huge difference. First responders, both police and fire, they've continued to respond to calls, maintain critical services to keep our community safe, and our essential service workers. They've continued to maintain our infrastructure and facilities and collect refuse and recycling. I'd also like to thank all of the people, both within the city's operations and the generous, truly generous volunteers and members of our community who donated their time and their resources during this pandemic. We're still in a pandemic and things are continuing. But this evening, what we'd like to do is share our early preparation, how we structure ourselves as an organization for emergency responses, what we've done to date to respond to the COVID-19 pandemic, and how that has affected our operations. We'll also touch on how we continue to emphasize resilience and a plan to just build us back better. Now you'll be hearing from one of our emergency service coordinators, megastar, Sarah Lana. I'll turn it over to you, Sarah.
Thank you, Dee. Good evening, council members and Berkeley community. I've worked in Berkeley's Office of Emergency Services for 9 years now, and I'm going to give you some more details about the work we've done and how it's prepared us for the COVID response, as well as some information about the plans and the structures that we use to manage emergencies in Berkeley. Now, Berkeley Ready is the umbrella program for all of the city's disaster preparedness activities. This includes the work that the city does to help the community prepare for disasters, as well as the work that we do to make city government ready to respond. Next slide, please. Berkeley Ready includes a wide array of community-facing programs, which are managed through the Office of Emergency Services in the Fire Department in partnership with the Public Health Emergency Preparedness Unit in HHCS. And we've been working on these programs for years. And in 2020, we've really seen how the plans and systems and community connections that we've made have been so valuable for Berkeley's response to COVID. As just an example, one is our emergency notification system, AC Alert. It's one of our key tools that we use to share what we call protective action instructions with the community. And we have used it regularly during COVID. Next slide. One program that we are particularly proud of is our Community Resilience Centers, or CRCs. The organizations listed are all CRCs, and the CRC program works with organizations that support day-to-day the underserved communities in Berkeley, who we know are more vulnerable to disaster impacts. The Berkeley Ready team provides CRC organizations with disaster preparedness outreach and trainings and equipment so that in emergencies, these organizations can continue to serve their communities with information and resources and connection. During the pandemic, we've had regular check-ins with CRCs where we provide COVID updates and answer questions directly. We also use these check-ins to understand how COVID is affecting these organizations and the people that they serve. In terms of resources, we've connected CRCs to key items like masks, hand sanitizer, and COVID signs so that they can use them in their work and provide them directly to their community members. Next slide, please. Now, the other half of the Berkeley Ready program focuses on city government's readiness for disasters. Our foundational document is our Emergency Operations Plan, which Council adopted in 2016. This plan provides the framework for our response to any kind of emergency. We used it just this last weekend for the fire weather and public safety power shutoffs, and we're using it for COVID as well. One key part of this framework is our Emergency Operations Center, which we call the EOC. The EOC is really, it's not a place, it's an organizational concept, and it allows staff from throughout the city and even external partners to come together to quickly address any kind of emergency. Now, the EOC does not replace field responders or departments or the city manager. Instead, it's there to help them with information and organization to make emergency decisions and to manage resources. Another key part of this framework is Department Operations Centers, or DOCs. In emergencies, departments have to continue their most essential operations. These are the activities they do to support life safety or that are legally required. At the same time, departments might also need to contribute to emergency response. So if departments need to change their organizational structure to do both of those things at once, they can use the DOC structure. And since Council adopted that emergency operations plan in 2016, it has not been on a shelf gathering dust. Instead, it has guided us in trainings and exercises and real emergency activations. Next slide, please. Since 2016, we have provided staff with 56 trainings to learn their roles in the EOC or the DOC. We've had 27 different disaster exercises. And an exercise, for those who aren't familiar, is a chance for us to test our plans and our trainings under a specific emergency scenario, like a flood or a fire. We've also had now 13 activations of our EOC or a DOC. I note that the slide says 12, but with this weekend's fire weather and PSPS, we have added yet another. And I want to take some time right now just to recognize and applaud two departments in particular for all of their work to establish their own Department Operations Center structure. HHCS and Public Works have very well-established DOCs. Their staff coordinate with our office in trainings and exercises and emergency activations. And the picture that you're looking at is actually of Public Works doing an earthquake exercise of their Department Operations Center. And obviously it's before the pandemic. But one other point I want to make here about EOC activations and the Emergency Operations Plan is the 2016 plan lowered the threshold that we had for EOC activations. It allowed us to activate the EOC at what we call a situation monitoring level for emergencies that we knew were stretching the capacity of the city's normal operations, but didn't yet have severe impacts. And this might seem like minutia, but this change has been incredibly important to help us build our city's emergency management muscle. Now that we're having more frequent EOC activations at lower levels, we've had many more opportunities to use and test and constantly improve our ability to manage emergencies. This has been extremely helpful for us because, as we all know, there is nothing like the real thing. And the other advantage that we found to these lower level activations is that they position us well when small incidents grow large. As an example that my colleague Katie Hahn will speak to, the COVID response began in January as a situation monitoring activation. And coordinating at this low level helped us to really smoothly scale up when COVID grew to be the pandemic that it is today. Next slide, please. Now to talk about how the EOC structure is coordinating the city's COVID response. So first, the EOC is supporting everyone with information. On the left side of the slide is an example of one of the internal documents that the EOC produces. This is called our Situation Status Report. Information from this document helps to keep responders in the loop, and it also informs our public communications. At this point, the EOC has produced over 100 of these reports for COVID. They contain information about the status of COVID here in Berkeley and across the state, along with the specific details of our work to manage COVID here in Berkeley. Second, The EOC is coordinating all of the new COVID response activities that don't really belong to any individual department. For example, we have COVID testing and the respite sites, which Katie will get into in her piece of the presentation. The EOC brings together the resources of every department to stand up and manage these special kinds of emergency operations. Third, and just as important, the EOC is helping the city to coordinate with its partners. Partners here in Berkeley, like BUSD and community organizations and UC Berkeley, as well as surrounding cities and the county. This connection that the EOC provides helps us keep a pulse on how COVID is impacting our community, and we use that connection to provide quick and consistent guidance about how we can all best respond to the pandemic. Next slide, please. And this is one picture of our emergency response organization during COVID. At the top, we have our policy level, which includes the health officer, Dr. Hernandez, the cost recovery director, David White, and the EOC director, Paul Budenhagen. Below them, we have the positions activated under the EOC umbrella. This doesn't include staff working within their departments, though, to address the pandemic, and David White will describe this later in the presentation. Now, keep in mind as you look at this that each position presented here might have more than one person staffing it at a time. Also keep in mind that this org chart flexes in order to address the needs of the emergency. So this was actually the picture in May. Since then, some positions have been demobilized with staff released back to their departments. And depending on the trajectory of the pandemic, we may need to further expand or contract the EOC structure in the future. As an example, one juncture where the EOC would need to expand would be in relation to a COVID vaccine that we would need to deploy to our community. Of course, eventually, we all hope that we will be able to fully contract the COVID EOC and demobilize it, but we do expect that that will be a long time coming. Next slide, please. And one last idea that I'll leave you with. As public employees in the state of California, we are all disaster service workers. This means that in an emergency, after we make sure that our families are safe and secure, we must return to work. And we may have to work in jobs that are very different from what we do normally. This responsibility is built into our administrative regulations and our training for new employees. And in the next section of this presentation, Katie Hahn will lead you through the major themes of the COVID response. Please keep in mind that the staff who are doing this work, we're generally doing so as disaster service workers. This means that they were redeployed away from their normal city jobs to do new jobs in unfamiliar environments that required a lot of quick learning and creative problem solving. As an example, our library staff have truly shined during this response. We had library staff supporting Meals on Wheels, making and distributing meals for our seniors when COVID forced us to close down our senior centers. Library staff operated our shower program for unhoused populations. They also worked in the EOC personnel unit, helping to find the right city staff to fill emergency response needs. None of this has to do with being a librarian, but it has everything to do with being a disaster service worker and serving our community to get us all through the pandemic together. So with that, I'm going to turn things over to my colleague, Katie Hahn, who has served as the COVID-19 EOC coordinator. She will give you more details on the key elements of our COVID response to date.